guys, and welcome back to the podcast. Today's episode is the part 2 of our healthcare and AI literacy that we did with Erika Warren. So if you haven't checked out part 1 yet, I'll make sure to put the link in the description below, and stay tuned for the rest of the episode.
I'm like, that is too much time. That's
Yeah.
too much time that I just wasted to get an answer that I probably could have gotten if I had just used IncitefulMed, right? You know, with the same thing. I'm like, it's all how you use it and what you need it for.
Yeah, and it's context, right? I mean, like that's when people are always like, oh, well, how do I use IncitefulMed? And I'm like, I'm trying to now help people unlearn this like prompting behavior, because it really should just be that like you ask a question regardless of who you are, and the answer is the answer. Like right? Like and the part of the problem with LLMs, right, is it's making up an answer based on your context. So if you could ask the same question, as you can say, as a clinician, patient presents, blah, blah, blah. As a patient, you can say, here's my symptoms. As an insurer, you can go do that. You will get 3 different responses because it knows, based on its data, what types of answers those different users want and hear and are most likely to happen, right? Like certain roles within healthcare have different guidelines. They have different like they have different incentives, like around liability or whatnot, right? And so our whole point in how Insightful, our like point of view and perspective on this, because we it's made for patients and caregivers, because that's who we were. And people were like, well, why don't you make it for clinicians? Like, why do we have to go all the way around where we educate patients and then they go back to their provider and then, try to convince their provider? It's like an extra step, like just give it to providers. And you just learn that in our system, the incentives are just never 100% aligned with patients. And so we would do that, and patients would be like, or providers would be like, I love this tool, but I want editorial access over the science and the content, because I don't want to include this half of the answer, or I don't offer this service. So if they decide this course of treatment, I'm going to lose somebody from my practice, or, different types of stuff. And so our point of view on this is like, what's published in peer-reviewed science is the bare minimum. You don't have to agree with it. It may not be applicable to your specific use case. That is the conversation you should be having with your provider. And providers are like, oh, I don't want patients to have access to the information. I call it like BS. Like, if you want to build trust, that is how you do it. Like, you go and you say, hey, I read this thing. It seems like it applies to me. What do you think? And they say, no, Erika, it doesn't apply to you because X, Y, and Z. And I'm like, cool. Thank you for hearing me. That makes sense. What do you suggest? If you just say, oh, how did you get access to that? You shouldn't have that. That's peer-reviewed literature. You don't know how to understand it. Like, bye. Like, no, thank you. Like, that's not how I want to engage. And so I think it's like a real opportunity to build sort of like trust when trust is already at an all-time low within the healthcare system and with providers, and not even from their own doing, right? It's this capitalistic pursuit that we've embedded inside of medicine, particularly in the U.S., that they're all fighting against too, right? Like, in many ways, it's easy for me to say, as somebody building outside of the system, to be like, I was like, I don't like those incentives, so I'm going to go over here because I don't have to follow those incentives because I think they're stupid. And like, I care about patients. Like, that's in some ways like an easy way out. But I also think it's how we disrupt and like make things better over the long term.
Yeah, I thankfully haven't had a lot of physicians or anybody in like I'll say medical authority make me feel bad about saying I read something or I saw something. Can I ask you questions about it or anything? It's been pretty limited for me on that. I've only had it just a couple of times, but we see patients all the time that are like, I wanted to be an informed patient. So I get this diagnosis and, maybe the doctor did explain it to you, but not in a way that you understood it. So you go online or you go to support groups or these nonprofits or anything like that, and you're doing some searching and you're trying to to figure things out, and then you go back to them with questions, if you get blown off because you're coming to them and asking about X, Y, or Z article or treatment or something, like, all you're trying to do is be like the best patient for yourself and for the doctor.
Yeah.
Because actually, if we understand things a little bit better, I don't want to say more compliant, but we become more compliant because we understand what the hell is happening. We're not going to
totally.
question everything because you explained it to us in a way that we understand. So now we're more comfortable with something, and, you know, there's a discussion, not just you're being told this, or if you ask a question, it's like, oh, well, that's above your head. It's like, so dumb it down for me then if it's
Right.
above my head. Like, tell me this in a way that I understand. You know, I always go in with information, but yet you have other doctors, and I've been in other situations where I'm like, hey, I know there's this new medication that's here to treat, you know, my issue. Can you talk about it? You know, what do you know? What's the access? What's the insurance? All this. They're like, what medication?
Yeah.
What? Why am I hold on a minute. Why am I bringing this up to you? You should already know about this. You treat the dang disease. Like, wait, what? That's happened to me more than the other way around. So it's like that even more so tells me that as patients, we need to be doing the research ourselves. We need to be asking these questions and have the reliable places to go to ask those questions so we can have good discussions.
Yeah, I mean, you just hit on, I don't know if you know this, but the average time from like a clinical breakthrough published to actual practice implementation is 17 years. The iPhone was invented 18 years ago. So, like, imagine that, like...
That's terrifying.
Yeah, and most doctors get their information based on, like, when they studied, right? And like then they build up heuristics based on how they've practiced, so they like start to pattern match more. And the way that information gets, like, there's a whole body of medicine called translational medicine, which is trying to close the gap from 17 years to something less, and in the last 50 it has not gotten smaller. Cool. Now you could say, like, the other part to think about this is, like, two new papers are published every minute. So, like, maybe staying at 17 years is actually, like, good given how the rate of research and publication and learning. But the, like, way that doctors are trained and educated and kept current on information is also fundamentally broken. Like, it relies on CE credits and going to conferences and reading journals and getting push marketing, like an email that's like, hey, I can't keep up with my own email. I'm not a doctor. Like, and if I was, the last thing I'd want to do is read that when I get home after a really stressful day of caring for patients. So, like, there's fundamentally a problem with, like, the tech can solve, like, how do you get the most current information in front of doctors at the point that they need to know it, so they're not like recall machines. And open evidence is a similar-ish tool to us, to IncitefulMed, that is doing that with clinicians. They work off of PubMed and use AI and some other tools to do that. And so, like, I hope that it will get better, but, like, what you just described, particularly in rare or complex conditions or who you're seeing, is, like, it's real. Like, it is, you would most likely know more if you've been researching than your doctor on a specific topic. That doesn't mean they can't scan the paper and, like, converse about it, but, like, that's just the reality of how information flows in our system. And that, to me, like, I learned that and I was like, what? Like, how have, like, tech has solved this? Like, you can open your phone and every social media algorithm you have has the most relevant, up-to-date information specific to the thing that you care about. And we use it for, like, polarization and a ton of shitty things. Yet, like, it hasn't applied to medicine. Like, what? Like, what an opportunity for, like, real good. But I would say, like, that's another thing that's just sort of, like, shocking in how the system works. And you then have to say, like, well, how do what are the incentives of fixing that, and who has the most to gain?
Mm-hmm.
That question starts to get kind of gross, because
Yep.
who has the most to gain are the people coming up with the treatments for it, which are, we all want, right? And
Mm-hmm.
like that takes research, but then now you're paying. Like open evidence is a good example. That's free for doctors to use. Why? How is it funded? It's valued at $12 billion off
Holy
of
moly.
pharmaceutical ads.
Yeah.
They have an ad model. It's free for doctors to use. You're just advertising in the product.
Mm-hmm.
Who's paying for those ads? Pharma. How do we feel about that?
Yeah.
I mean,
It's so hard. Like
yeah.
when we're in situations where like you need, medications, you need things like you need pharma, you need
Yeah.
pharmaceutical medications. It's like, and if everybody, I know some really great people in pharma and I know some really not great people in pharma, but that's in everywhere. There's
Yeah.
great people in nonprofits. There's not great people in nonprofits. There's in for-profits and this, that, and the other thing. It's like, it depends. And that happens no matter what. But, I know that some people have really strong feelings about that because that's just how they feel. And, okay, maybe they don't want to use that because they don't like that and they feel icky. But, there have been some, commercials and there's been information out there around me where I'm like, that could help me.
Yeah.
And then I go to the doctor and I'm like, hey, I saw this. Like, what do you know about this? They're like, I don't know. Let me go home and do some research. And then they went home and did some research. And then the next appointment I had, we talked about, what is this and how could this help me or how it might not help me? I even had in another group I'm in for a different disease state, there's a medication that's no longer available. It's off the market and it has been oh gosh, at least 5 years, maybe more. Now, this person goes to an appointment and the doctor actually was like, I'm going to try to get you on this medication. And they're new, so they kind of don't realize that this medication's like not a thing. And they come into the group and they're talking about it. And all of us are like, you can't get that. Like, you can't get this. You can't get that anymore. Like, we can't get it. You can't get it. How was this physician so far behind in treating this disease or even have the ability to treat this disease, trying to pick a medication that they don't even have access to? So that tells me, again, to your point, that they're not getting the access to the new research, to the new thing. That was the last time that maybe they had a patient with this disease because it's a rare disease. So they didn't keep up on it to know that it's not widely available anymore. But that puts some distrust on the patient now for when they go back in. They're like, how can I trust you to make decisions for me when you didn't even know that wasn't available anymore? So it's like, how do we get the information in front of all the people that need it to the best way possible for the best outcome for all of the people involved?
Yeah. I mean, look,
like, $1 question.
Yeah. I mean, that's where I think that like actually computers and AI can like solve, because they are encyclopedias. Our brains are not meant to be that. The ability to like know what you don't know. I worry about even this with doctors, right? It's like open evidence is a recall tool, just the same as up to date, and like any of these tools are. You have to you have to know what to ask. Like, unless you're just blindly typing in like, how do I treat gastroparesis? Like very like that's not how doctors are using this. Like they're remembering something and then looking it up, and it's like, well, that doesn't help you know what you don't know, discover new possibilities. Like we have to use tech to solve that problem, and it can. Like that's a better use than having it discern judgment in where like humans need to be in the loop and using like their brains for those tasks rather than these recalls. So I think the thing on like financial incentives and whether you're pro pharma, not like that doesn't matter to me. The thing that I've seen coming from outside of healthcare is that if you're getting something for free and somebody else is paying for it, the person who's paying for its priorities matter most, right? So like, let's take Open evidence as an example, right? It's free for doctors. We want doctors to have access to this. Hooray. Great. I want doctors to have access to all this information too, as we've already discussed for all those reasons. My worry is if the only monetization model is ads, then what happens when those venture capitalists who funded that company come back and say, I need you to grow more? Because that's what they do. Do you like delay the results, the search results, so you can run more ads? Do people start paying for certain like prioritized ads on certain queries? What do you do? Like at some point, it's a tool that has a bunch of investment into it that has to generate a return and make a bunch of people money. And the person right now, like doctors aren't paying for it. Up to date is a license tool. Like hospitals and doctors buy licenses. The person paying for those tools is their primary customer. It's the one whose problems they have to solve. An open evidence model or any product like Facebook is a similar, or any social media. It's like it's free for us regular people to use it. The way they make money is off of ads. That has created the inciteification of those products. Like I don't want that to happen to any medical product. It already has to WebMD. Like it's in many other like instances. And so my PSA on all of this is like, as a user of technology, be curious about how a thing makes money and how that person who's paying for the thing that you get to use, if their incentives align with yours and when and when not, and just be aware of it. Right. And like, that's the only thing. I've just been on the other side. I've been in venture-backed tech companies for pretty much my whole career until now. And I've sat in the rooms that are like, we need more. And you're like, okay, but like, this is going to make it worse for everybody. And they're like, well, should have thought of that before you asked us for a loan and an investment, right? Like, and so there's like, it's just, we don't want to be in that position. And it's just another one of those things where, unless you've lived that life, it's hard to know what to look for.
Yeah, and that's really helpful. I think just, going about the AI literacy and and tech literacy to really just understand like what we're doing, because when marketing is so good, it's really easy to not ask these questions. Or when you get a couple things that happen to work out for you really well, that's great, but maybe you stop asking those questions. And when there's something so much, at the forefront of this, which is our health, our well-being, and all of the things that we don't need more problems with. We want quick answers, we want reliable answers, but we also need to make those choices. And I'm hopeful that, everybody who's listening to this is really going to take a minute to kind of, not to be like, please reflect after this episode, but, really like to take a minute to say like, have I had these thoughts? Have I thought this through? What am I comfortable with? And, to the other side of that also learning that there is another tool out there, especially when it comes to learning more about their own condition and to be, more comfortable in the doctor's office, learning how to better advocate for themselves, how to communicate, take back some of our own agency and utilize a tool that you can now see and hear from one of the people who's behind it. You don't always get that opportunity with these larger tools and things like that, right? Like you might if you get really lucky, but now you get to see like, where did this come from? How did this come to be? And why did it come to be? What you were saying, like just even thinking about the money behind it, who's making it, what might we be giving up in order to have something for free? Now they know when they go to use IncitefulMed, when they're going to use this tool, they understand that better. And if they have questions, they know they'll get a real answer because you guys are real people.
Nothing makes me more excited than getting an email from a real human, one, and then two, one that's actually used our tool. Either, good, bad, ugly, like Thankfully, it's usually, some sort of praise or kudos or a story that like gets us out of bed every day. And it's
Yeah.
like, yes, it's working. It's like actually helping people, which is all we really care about.
Yeah.
But even if not, like I'm hello at IncitefulMed.com. INCITE, it's the play on words, FUL med.com. I feel like we've sort of like I went on this whole like bad capitalist like rant. So I should also just say like we're very much in our bad capitalist era. This is usually when people tell me I'm a terrible business person. And IncitefulMed is free. It is free to use for now. We are trying to grow. It does not cost us a lot of money to run it because we are not an LLM. Like we are not spending all these tokens generating answers. We're using our I actually didn't tell back up and tell this story too, but we are trying to grow scale so that we can figure out what the natural usage is for patients. Like, I hope that you're not up at 2 a.m. every single night Googling using IncitefulMed or like researching. And so it doesn't make sense for us to like create an arbitrary monetization scheme when we don't understand how much people need a tool to use it, how frequently, and like what costs. So like we're eating the cost ourselves to better understand and learn so we can match what's useful. Our goal is to help people and to build a sustainable business so that, frankly, I never have to create another org chart or do a performance review again. Like, I don't want to do that anymore. So I want to like work on this product. I want to give it away to as many people as possible. I want it to be self-sustaining. We are not venture backed. We've turned down funding. We're self-funding, and our plan at some point is to charge once we've answered many of the questions that I've alluded to. So like I'm not here to say like I believe in full transparency. If you have questions, you should email me at hello about any of this or other things. I really like talking about all things tech and business and health, and answering questions on it. The one thing I said it like doesn't cost us as much as like an LLM to run. IncitefulMed started from our personal necessity, but like the foundation of the technology was the library service tool that I mentioned. So like 6 years ago now, my co-founder Mike built an academic literature discovery tool. I describe it as like 6 degrees of Kevin Bacon. It connects academia to one another and like creating this cool visual map that shows you like how different topics are related to one another, how different researchers are related, and like it's his spouse is an academic in like a pretty niche field. And so he built this as a curious person and like someone who is familiar with this problem of like, how do you put smart scientists together so that they can advance the study of their field? So he created this tool. It is the backbone of our technology. It's another tool that exists. It runs off of all open access information. It's not specific to medicine. People are like, all of PubMed, that must be huge. And I was like, well, it's way less than all of science, which is what we do over there. And it's a tool that we give away for free because it works off of open access data. And so it feels icky to like charge for something that, science has already paid forward, and we're trying to advance the study. It's used by librarians and researchers and academics all over the world. It itself has been cited over 100 times in peer-reviewed publications, just as like the tool that it uses for research. So anyway, like that's the fundamental technology under IncitefulMed. When I said that we like build library grade tools, like that's it. What we do is just like wrap an LLM around the outputs of that so we can say, make all this medical stuff make sense to like a random person like me. And like that's way, way, way cheaper than what ChatGPT or whatever tool you're using is doing when you are asking and engaging with it. So yeah. Anyway.
That's cool. I like that. That's just cool. I like just understanding these things, right? Like these are the things that like we use these tools all day long, but like I don't know how my phone works. Like I don't know like what's a cloud. Like I don't know. I just know my stuff's in there, right?
Yeah.
Like that's just the kind, like I don't know. These things just work. So really understanding that, I think, is really important too. Like you don't always have to, and that's not like necessary, but it just adds another layer of really like appreciation, honestly, for the technology, especially when you get to kind of see how it works and how that brings you this information. So it, at least for me, it gives me another layer of trust in something like this, in the build, in the model, in the output, in the information that it's giving me, because I understand it a little bit better. And, that's something that I think we just don't get enough of. We're so inundated with all these things that we want information quickly, fast, now, correct. I don't
Yeah.
have time for this. I don't have this. I don't have that. Like, it's just you want it now. And I get that. I'm that person too. But it's nice to really be able to kind of sit and understand how you got something. And it's interesting. I like learning. That's really what it comes down to.
Me too. That's it. So we're just a bunch of nerds that are like stringing stuff together to make it usable for people who may care or may not care. We've been working on our how it works page. Like we've gotten to the point where we need like a how does it work to explain to like people.
Yeah.
And so like I'm still, obviously we've been talking about it. It's like not as succinct as it needs to be, but we did just see that the NIH and the VA have been using the library tool for their own. It's like we're cited in many of their publications. So we're like, that's so cool.
That's
like,
cool.
How do we
That's cool.
highlight that? And then it's like now patients can use the same technology that they're using to answer their own health questions. And,
That's
show up.
Cool.
Don't be a jerk when you show up to your doctor's office, because like you said, Sam, like you may know more. You might be more educated and informed on the latest research. That's the other thing. We update every week. So anything that's been published new gets integrated. And so like it is a very real possibility that if something new has come out, and we allow you to like sign up for like alerts and stuff. So like on a specific topic, you can stay informed. We're doing all kinds of stuff. You have the tool, and we're creating some patient guides, which are essentially like condition or disease specific, that summarize all of the medical literature about a specific disease and explain it like along the patient journey. So like here's probably what symptoms you were, and like, oh, by the way, it probably takes you 7 years to get an accurate diagnosis for some of these complex and chronic conditions. Like 7's actually kind of short for some others. And why that is, and what the research says, and how is it diagnosed? What are the tests that are done? And, it just follows a journey. So like wherever you are in the stage, you can learn more. And then we have a ton of questions, like the common questions that people ask within that. And so I don't think it's a surprise that the majority of people that are finding a lot of value out of IncitefulMed fall into the chronic, complex, and rare disease space, because they're the ones that have been most acutely searching for answers. And so like unfortunately, what's the saying, like the least rare thing about a rare disease is having one. Like there's like 16,000, but a third of the US population has a rare disease. And so this is not, you were saying like people in your community feel really like alone and gaslit, and it's like what I hear is like pretty much everybody feels that way, which I'm not sure is better, or that we should take like comfort
it is, but
in
it
that.
Isn't, it's collective suffering.
It's not a unique problem for a large majority of the population. And what I will say is that like while there's a ton that we don't know in science, there's a ton that actually is known. It's just not practiced because of how population-based medicine works. So like from our own experience, the power is, it's there in the literature, but no one has thought about how to pull it out and connect these two dots, what you're seeing with what's in the science. And if you can take that insight back and be like, here you go. Somebody just told me they did a search for trans population with MS, and they were like getting science back. And they're like, I mean, trans population is 1%, 2% of the population.
Yeah.
And there's like, we've taken one study or like one specific disease and can like extrapolate a bunch of information about how a disease impacts this community of people. Like,
Wow.
that's incredible. It's there. It's like, not every answer is in the science, but like a lot are that we aren't like having access to. And so that's the thing that like gives me a lot of like hope for folks that are stuck and feeling like they're on this odyssey of medical mystery.
I know a lot of people that are stuck there. So I'm just, really grateful. Thank you so much for all of this information. I am not an expert in this area, so I'm glad that we found one to talk about with all of this. And I'll put all the information for anybody interested into our description on like how to sign up and, emails if they have questions and everything, so they can reach out to you and test out the searching, and hopefully we'll help get some more people answers, because that's really all we want. We just want answers, and we just want to feel better. Like I just want to eat more than like toast, maybe, in the next however, like I want to figure things out. I want to ask questions and like not leave my doctor's appointment with the advice of maybe you should go manage your stress better. Like, cool, this really helped me manage my stress a whole lot better, like that's
a doctor
great.
just told me that too, and I was like, do you see the world? Like, what are you talking about? Like,
that's usually when I'm like, have you been outside? Like, have you turned on the TV? Like, do you know where we are? Like, have you seen my medical file?
I was like, I think I'm doing pretty good. I don't think it's stress, but like, if you have a suggestion about this, then like by all means, like I don't read the news, I don't do really anything online anymore, so I feel pretty good.
I do this. This is my online presence now, is just this, but it's just so good to know that there are these things out there, good people behind it, and I'm just excited to share this with the community. So thank you so much.
There's hope in the humanity still. There are still good. You just got to find the helpers, and we try to help the helpers. So yes, please, if you're curious, give it a shot. Email me. I'm happy to answer any questions. And and ideas. We're constantly trying to be like, how else do we support patients in their journey to get not just more information, but like use it. So my whole background is like, knowledge is power, but like only insofar as you can actually turn it into action. So how do you turn it into action in an environment where you don't actually have any decision-making capacity other than like if you're going to take your medicine or not, and like follow the instructions. And so that's where it's like a really fun puzzle. I like to think about how to play with and like help people navigate power imbalances and like how to advocate for themselves when they have less positional power just by the nature of the relationship. So that's what we're over here trying to figure out and help patients.
Solving the world's problems, one day at a time.
Why not?
I mean, we've got, it's like there's nothing else to do. So, why not take on all the problems and just try to fix them?
We'll start here. See how far we get.
Well, thank you.